Hi, I'm Dr. Sarah Wettergreen. I am a faculty here at the University of Colorado Skaggs School of Pharmacy and Pharmaceutical Sciences. HPV stands for the human papillomavirus, and it has over 150 different types of this virus. Not all of those virus types have problems associated with them, but for those that do, they can be serious. So if people have HPV in their system and it's not clearing over time naturally, things that can occur are most commonly genital warts. That's not overall common, but that's the most common thing that we'll see from this infection. Outside of that, there's a risk of cancers. So any areas where there can be sexual contact and exposure to HPV are areas where they can get cancer. So cancers of the mouth and throat, and cancers of the genitalia. So there is a vaccine to help prevent HPV. It is called Gardasil 9, and it contains 9 different types of the HPV vaccine. People do need to get multiple doses to have that full protection against HPV from these 9 different types. You cannot get HPV from the vaccine. The vaccine is inactive, meaning the virus is dead inside this vaccine. It cannot cause an active infection. What it will do is build an immune response to HPV and these certain types that are in the vaccine. So if there are future exposures, the body's already prepared to fight that off. So the ideal time to get the HPV vaccine is prior to initiation of sexual activity. The recommendation is that in most people, 11 or 12 years of age is the ideal time. The youngest you can get the vaccine is around 9, and for most people, it's recommended up to age 26. So if someone is below age 26 or at age 26 and has not completed their series of the vaccine, it's recommended to catch up to have that full protection from the vaccine. There is an extended recommendation that came out just in the last year, so now people above age 26 can get this vaccine all the way up to age 45. However, this is a little bit more of a shared decision-making process. So we're thinking about people who might have new sexual exposures and have new exposures to different types of HPV. So not all patients are indicated for that vaccine, but it's really based on their risk factors at that time. The vaccine is generally very well tolerated. Most people might have a little bit of arm pain that's quite mild and usually resolves in about a day or so. Other things that might happen are things that are similar to an immune response, something that you might feel like when you get sick. So a little bit of a fever, feeling a little bit groggy, and this usually only lasts about a day or so. If someone has symptoms much longer than that, it's likely due to a different reason and they should follow up with their provider.